Recently, my family and I went to visit some friends and family in Texas, and were surprised at how Texans were responding to the uh, mask mandate by Governor Abbott. We figured of all places where people would defy blanket mandates, it would be Texas. And honestly, we found pretty much everybody going along with it. Talked to a lot of people that were against it, but they were just going along with it. And that was kind of frustrating for both sides. I mean, one, just having the mandate, and two, seeing a lot of people not standing up to it. And so we were happy when we got back to Ohio, where, hey, there's no mask mandate and we can just go about our lives. Until the next day, this happened.
Last week, I called upon all Ohioans to wear a mask when they were out in public. The evidence is just abundantly clear. As I said, the jury's back, the verdict's in, masks work, and particularly when masks are used with the social distancing, the two layers. We know from what's happening nationwide, we know from what medical science tells us now, and we know so much more today than we knew at the beginning of this pandemic. We know that the wearing of masks in those yellow counties and in those orange counties will in fact make a difference and may help those counties not turn red. So doing this in those counties where the threat level is lower at the current point makes sense. It's essential that we wear masks statewide in Ohio to contain the spread of this virus. So therefore, tomorrow at 6 o'clock, tomorrow night, our mask order for people who are out in public will be extended throughout the state of Ohio. So
Seriously, I take a few issues here with what the governor said, particularly about how the jury is out, they've gone into deliberation, and clearly masks work. Why don't we take a look at the actual scientific studies that have been done and see if those words are actually true? Alright, so I have my trusty whiteboard of science here, and we're going to look through 20 papers that I found mostly through just a PubMed search on masks, face masks. Anybody can do this. It's not that difficult. Now, some of these studies are meta-studies, which looked at a whole bunch of papers and sort of boiled down the results into one. This isn't that systematic, but I think we can see some trends overall in just a quick search and compilation. So let's see, we're going to keep track here, keep score. We'll put here the lead author, and we'll say if it works, plus. If it doesn't work, the minus. That's clear enough. It's not quite as dark as I would like it. Yeah, that's a little better. So, alright. So the first one here, I try not to go too far back, but the first paper I have here is from 2005. The title is Disposable Surgical Face Masks, a Systematic Review. It was by Lippin Edwards. And here's what they said in their conclusion. They were looking at surgical teams. The main results, 2 randomized controlled trials were included involving a total of 1,453 patients. In a small trial, there was a trend towards masks being associated with fewer infections, whereas in a large trial, there was no difference in infection rates between the masked and unmasked group. Neither trial accounted for cluster randomization in the analysis. And then the reviewer's conclusions. From the limited results, it is unclear whether wearing surgical face masks results in any harm or benefit to the patient undergoing clean surgery. So I was looking at surgical masks in the operating room. Small trials showed maybe a positive trend, but a larger trial, not so much. So I'd say that's inconclusive results. So we'll actually, at a third symbol here, we'll give it a question mark. So the next one is from 2009. So if you remember, in 2009, in that period, we had the H1N1 going around, which, by the way, had 60 million cases in the U.S. compared to the 4 million we had from COVID. So the title of this paper is Use of Surgical Face Masks to Reduce the Incidence of the Common Cold Among Healthcare Workers in Japan, a Randomized Controlled Trial. Now, this is by Jacobs et al. And, the first one here was from the Canadian Operating Room Nursing Journal. This one is from the American Journal of Infection Control. And let's see, what were their conclusions here? So they said subjects in the mask group were significantly more likely to experience headaches. Face mask use in healthcare workers has not been demonstrated to provide benefit in terms of cold symptoms or getting colds. So I would say a negative here, but headaches there's a positive trend there. Now, one problem with this is it was a small study. There were only 32 healthcare workers in that study, so that's a downside of this one. All right, we've got another 2009, and this actually comes from the World Health Organization. It's entitled "Advice on the Use of Masks in the Community Setting in Influenza A H1N1 Outbreaks." So here they were looking at the community setting. Here's the quote from it. "In the community, however, the benefits of wearing masks has not been established, especially in open areas, as opposed to enclosed spaces while in close contact with a person with influenza-like symptoms." So, according to that, this isn't a scientific paper, but the advice from WHO, it shows no benefit. All right, then 2010, and in picking these, I didn't pick and choose. You'll see there's going to be some that show positive results. These were just the ones that I found. I'm sure there's more that I missed, but from this sampling, let's just see maybe if there's a trend or if we get more positives than negatives. We're just going to follow the science. All right, so 2010, this was Cowling et al. Titled "Face Masks to Prevent Transmission of Influenza Virus, a Systematic Review." So this is one of those meta-studies. This was in the Epidemiology and Infection Journal from Cambridge University Press. So here's a quote. "There is some evidence to support that the wearing of masks or respirators during illness to protect others and public health emphasis on mask wearing during illness may help to reduce influenza virus transmission. There are fewer data to support the use of masks or respirators to prevent becoming infected." They looked at 4 studies in 2007. In 2008, they were looking at communities or households with, and overall, there was no significant difference between mask or not mask by itself. Mask plus hygiene, like washing hands, seemed to actually have an effect. So masks in and of themselves, there was no significant improvement. Our review highlights the limited evidence base supporting the efficacy or effectiveness of face masks to reduce influenza virus transmission. So, again, not really, maybe with hygiene considerations. 2011, very dark. Let's do this one. Benriza. This was in the Influenza Journal. It's called The Use of Masks and Respirators to Prevent Transmission of Influenza, a Systematic Review of the Scientific Evidence. All right, I'll quote here. Development of evidence-based guidance about mask/respirator use is intrinsically linked to what is known about how influenza is spread and specific risk factors that can affect transmissibility, e.g. host factors, pathogen factors, environmental factors, and particle size. However, this is an area equally fraught with uncertainty. There are limited and conflicting evidence regarding the relative importance and frequency of direct contact, indirect contact, droplet, and aerosol modes of transmission. In conclusion, there is a limited evidence base to support the use of masks and/or respirators in healthcare or community settings. Okay, so basically this is another question mark. It's hard to tell. Alright, so that's 5. And I'm writing too big, I'm going to run out of room here. So that's 5. And we've got 2 unknowns and 3 no. So far I don't see the evidence being so overwhelming. So 2013. This is Rubman et al. The title here is Physiological and Other Effects and Compliance with Long-Term Respirator Use Among Medical Intensive Care Unit Nurses. Alright, so this is a little bit different from the other articles. This one I think is worth noting. This is from the American Journal of Infection Control. This is looking at how wearing masks affected the nurses. Okay, so here's the quote. Most nurses, 90%, with an N equals of 9, tolerated wearing respiratory protection for 2 12-hour shifts. CO2 levels increased significantly compared with baseline measures, especially when comparing an N95 with a surgical mask to only an N95. But changes were not clinically relevant. So, CO2 levels were increased, but not significantly. There wasn't a significant change. Perceived exertion, perceived shortness of air, and complaints of headache, lightheadedness, and difficulty communicating also increased over time. Almost 1/4, 22%, of respirator removals were due to the reported discomfort. N95 adjustments increased over time, but other compliance measures did not vary by time. Conclusion. Long-term use of respiratory protection did not result in any clinically relevant physiological burden for healthcare personnel, although many subjective symptoms were reported. N95 compliance was fairly high. All right, so there's 2 things we need to note here. One, the clinically relevant physiological burden was not statistically significant to say there was an issue. But on the other hand, all the symptoms that the healthcare workers felt, the shortness of breath, the difficulty communicating, all of that was there. It was reported. So that's still an issue, even if it's not a measurable issue, numbers aren't everything. So I'm going to say give this one a eh. So it's we aren't really looking at transmission. There's a suggestion of it's okay, and there's a suggestion of there's also some significant problems. So maybe that should just be a question mark. All right, 2015. This is McIntyre et al. And this is from the BMJ Open. The title is A Cluster Randomized Trial of Cloth Masks Compared with Medical Masks in Healthcare Workers. So here we go. Here's one with cloth masks. So results. The results of all infection outcomes were highest in the cloth mask arm, with the rate of influenza-like illness statistically significantly higher in the cloth mask arm compared with the medical mask. Cloth masks also had significantly higher rates of influenza-like illness compared with the control arm. Not only were the cloth masks worse than the surgical masks, they were actually worse than no masks at all. It says penetration of cloth masks by particles was almost 97%, and the medical masks were 44%. All right, so here's their big conclusion. This study is the first random RCT. What is it? Randomized control trial. It's the first randomized control trial of cloth masks, and the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks, and poor filtration may result in an increased risk of infection. Further research is needed to inform the widespread use of cloth masks globally. However, as a precautionary measure, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. So, definitely a big negative for cloth masks. All right, so go back to 2015. This is Zhao et al. From the Journal of the Royal Society of Medicine. And their title here is Unmasking the Surgeons, the Evidence Base Behind the Use of Face Masks in Surgery. All right, so this is sort of the quintessential place that face masks are used, is in surgery. So this is another one of those meta-analyses. It said examination of the literature revealed much of the published work on the matter to be quite dated, and often studies had poorly elucidated methodologies. As a result, we recommend caution in extrapolating their findings to contemporary surgical practice. However, overall, there is a lack of substantial evidence to support claims that face masks protect either patient or surgeon from infectious contamination. So, looking at the evidence, they don't see in surgery masks doing their job. So, there's a lack of substantial evidence. So I don't want to make a argument from silence fallacy, so we're going to call this questionable. All right, now another 2015 study. This is from Tong et al. And this is from the Antimicrobial Resistance and Infection Control Journal. The title is Respiratory Consequences of N95 type mask usage in pregnant healthcare workers, a controlled clinical study. So here's a quote. Breathing through N95 mask materials have been shown to impede gaseous exchange and impose an additional workload on the metabolic system of pregnant healthcare workers. So this is an infection control, but now we're seeing the load that it puts on the human body wearing the respirator. So N95 could cause breathing problems. So we'll put negative here with the note breathing problems. All right, so it's not an infection negative, but there are negative consequences. All right, 2016. This is by Sokol et al. From the Transplant Infectious Disease Journal. And the title is Masks for Prevention of Respiratory Viruses on the BMT Unit, Results of a Quality Initiative. So BMT is bone marrow team. We're looking at the bone marrow team physicians and how masks help or not help that particular group of people. So the bone marrow team results. The 2-year incidence of RVI, respiratory viral infection, I believe is that acronym. The 2-year incidence of RVI in the pre-mask period was 14 out of a total of 15. 14 out of a total of 15,001 patient days. Sorry, on the unit versus 2 out of 15,608 patient days after mask implementation. So you went from 14 incidences out of 15,000 days without masks to 2 incidences in 15,000 days with masks. The difference in incidence of respiratory viral infection within the 2 time intervals was noted to be statistically significant. So 14 on one, 2 on the other. That doesn't seem like a big difference, but I'll take their word for it. Our quality initiative demonstrated that the surgical masks are an infection control modality that may provide benefit to oncology/BMT units by decreasing the risk for hospital-acquired RVI. So we've got a positive one. Okay. Again, 14 versus 2 out of 15,000. Doesn't seem like that big of a change, but unless I dig in and get all of their data, I'll take their word for it. All right. So just a handful more. 2016. Smith et al. This is from the Canadian Medical Association Journal. The title is Effectiveness of N95 Respirators versus Surgical Masks in Protecting Healthcare Workers from Acute Respiratory Infection, a Systematic Review and Meta-Analysis. So here I'm going to stop reading quotes for all of these because this is getting to be a long video here. But essentially what they found here is no significant change from N95 over surgical masks in the study. Laboratory work says they should be better, but in practice, they seem to be about the same. So I'm going to put a question mark there. It didn't show improvement over N95 to surgical masks, but it didn't really say whether either were better than nothing. All right, we're getting to more recent papers. So 2017. All right, this is by Ofedu. I'm not sure if I'm pronouncing that name right. Et al. From Clinical Infectious Diseases Journal. The name is Effectiveness of Masks and Respirators Against Respiratory Infections in Healthcare Workers, a Systematic Review and Meta-Analysis. A lot of these are meta-analysis, and there is some overlap on these. Again, this was just a cursory study. We could dig in deeper, but I think this is good to give at least a general idea. So, all in all, they were in favor of using masks, although they said findings are inconsistent within and across studies. So I'll put an inconsistent note here. So maybe I'll bend this down a little bit so we can get some more space. All right, now we come to more recent 2019. This is by Radonovich. Et al. This is from JAMA, and the title is N95 respirators versus medical masks for preventing influenza among healthcare personnel, a randomized clinical trial. All right, so here in this pragmatic cluster randomized clinical trial involving 2,862 healthcare personnel, there was no significant difference in incidence of laboratory-confirmed influenza among healthcare personnel with the use of N95 respirators, which was at 8.2%, versus medical masks, 7.2%. So again, give that a question mark. There's no difference between N95 and surgical masks. So maybe I should put that note, N95 versus surgical masks. All right, now we come to more recent stuff. Now, one of the reasons why I went so far back was because obviously masks are politicized right now. So I wanted to find a scientific study or scientific studies that weren't about coronavirus and all of everything that's going on right now. So now we get into some more recent ones. So the next several are from 2020. First is Klompus. Et al. And this is from the New England Journal of Medicine. This one was cited by WHO. If you go to the WHO website, at least at the time of this recording, or a couple of days ago when I made this list, they cite this paper and basically this quote here. The title of the paper is Universal Masking in Hospitals in the COVID-19 Era. Right, here's the quote. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. And WHO quotes this paper saying masks are not needed in public. Now, if you follow the letters to the editor in the New England Journal of Medicine, Klompus himself wrote a letter to the editor saying people are taking this quote out of context, that this paper was actually arguing for more masking, not less masking. And this quote was because when you interact with most people in public, it's a passing interaction. You're walking past somebody, you nod, whatever. You don't interact face to face very much, except with a few people in public. How is that an argument for more masks? Yeah, if you have, if you walk by somebody, masks aren't going to do diddly squat because you're barely in contact with that person. But you go home, have dinner with your family, talk to each other. There's a lot of contact. That's one of the things they brought up was the intensity of contact between people. And when you're just going out in public, unless you meet a friend, you're probably not going to have too intense of a conversation. Unless, you're one of those people that never met a stranger and picks up a conversation with everybody. That's not me. So I'm going to give a big negative here. And I'm going to put links to all of these papers down in the description, so you can go find them yourself. All right, another 2020. This is Long et al. This is for the Journal of Evidence-Based Medicine. Should be good, right? And this is effectiveness of N95 respirators versus surgical masks against influenza, a systematic review and meta-analysis. We've seen this a couple of times, right? So again, they found no difference between the N95 and the surgical masks. So I'm putting a question mark there. I probably should put a negative because it's not telling us whether we should wear masks, although everyone's saying the N95 is like the gold standard. I've got 3 examples that it's not. Alright, so I'm going to hunch over here so we can get the last few in. So 2020, Godoy, et al. This is from BMJ Global Health. The title is Facial Protection for Healthcare Workers During Pandemics, a Scoping Review. Here's a quote here. Comparing with surgical masks, N95 respirators perform better in laboratory testing, may provide superior protection in inpatient settings, and perform equivalently in outpatient settings. So I'm going to give this a plus question mark. Again, N95 versus surgical masks. It works better in the laboratory. Great, but that doesn't tell us if it works in real life, like we saw in an earlier paper. May provide protection for inpatient. Performs about the same in outpatient. So kind of a mixed bag. All right. 2020. I am not going to try to pronounce this name. I just said I wasn't going to try to pronounce it. This is from Plus One. The need of health policy perspective to protect healthcare workers during COVID-19 pandemic. A grade rapid review on the N95 respirators effectiveness. Wearing N95 respirators can prevent 73 more clinical respiratory infections per 1,000 healthcare workers compared to surgical masks. This one says N95 are better than surgical masks. Two papers left. 2020, Park et al. This is from the Emergency Infectious Diseases off the CDC webpage. The article is Contact Tracing During Coronavirus Disease Outbreak, South Korea 2020. So here's the results. We analyzed reports for 59,073 contacts of 5,706 coronavirus disease index patients reported in South Korea during January 20th through March 27th of 2020. Of the 10,592 household contacts, 11.8% had COVID-19. Of the 48,481 non-household contacts, 1.9% had COVID-19. Use of personal protective measures and social distancing reduces the likelihood of transmission. But notice, you are 10 times more likely to contract coronavirus from a household person than from someone outside your household. And then that's just looking at the percentage. If we looked at just the raw numbers, let me do it in my head. So we'll say 10% of 10,000, 1,000, and then 2% of 48,000. So let's see, 1% would be 480, double that, so close to 1,000. So if you look at raw, just person contacts, it's close to the same. If you look at percentage, so you have fewer household contacts, but you're more likely to catch it from someone in your household. Actually, I haven't converted it to raw numbers until just then. It's about the same. It's interesting because then it doesn't matter. Like if you have a brief contact with someone or a prolonged contact with someone, the odds are about the same if you're looking at that. I'm trying to do math and statistics in my head here, so I could be wrong in that. So how should I score that one? I'm going to say, give it a plus because they did say personal protective measures and social distancing reduces it, but I'll say household more significant. All right, and then our last paper here. I'm not even going to try to spell this name. Hughtai. Again, this is from the CDC website under Emerging Infectious Diseases. The title of this one is Effectiveness of Cloth Masks for Protection Against Severe Acute Respiratory Syndrome Coronavirus 2. All right. Until a cloth mask design is proven to be equally effective as a medical or N95 mask, wearing cloth masks should not be mandated for healthcare workers. So, should we be mandating it for everybody? In community settings, however, cloth masks may be used to prevent community spread of infections by sick or asymptomatically infected persons, and the public should be educated about their correct use. Even though earlier studies showed that you actually are putting yourself at risk by using cloth masks. So I'm going to call this a negative for cloth. All right, so if we look at the whole board here, I can't see that. I'll put it over here. So we've got negative, question mark, plus. So let's look at the negatives. We've got 1, 2, 3, 4, 5, 6, and we'll do 7. So 7 negatives. question marks. We've got 1, 2, 3, 4, 5, 6. Count that as 7 question marks. Then pluses. Wait, did I count that one? 1, 2, 3, 4, 5, 6, 7, 8. Nope, that's 8. 8 question marks. And then pluses, we have 1, 2, 3, 4, 5. So, we can debate some of this, and yeah, some of these question marks were the N95 versus surgical masks. But my point here is not that masks don't work. My point is not that masks work. My point is the jury is not out.
The evidence is just abundantly clear. As I said, the jury's back, the verdict's in, masks work.
The jury is not out. If we look at the evidence
is just abundantly clear.
I mean, are some of these studies biased? I don't know. 2021, things are so politicized. I would question the bias, but taking it at face value,
the evidence is just abundantly clear.
The jury's not out yet. So, mandating masks because the jury is out?
The evidence is just abundantly clear. As I said, the jury's back, the verdict's in, masks work.
Is a false narrative. I think one thing that was interesting, I thought I'd written a note, but I guess not. One of the studies talked about how you don't even know the best way that this thing is transmitted. And that was talking about influenza, something we've been studying for decades.
The evidence is just abundantly clear. As I said, the jury's back, the verdict's in, masks work.
Coronavirus, WHO has gone back and forth about, and the CDC have gone back and forth about how this thing is transmitted. It's transmitted on surfaces. It's not transmitted on surfaces. Yes, it is transmitted on surfaces. It's not transmitted in person-to-person contact. Oh, yes, it is transmitted in person. They've gone back and forth in the last several months.
The evidence is just abundantly clear. As I said, the jury's back, the verdict's in, masks work.
So if we don't even understand influenza yet, do we really understand COVID-19? So, with all due respect, and I'm losing it, Governor DeWine, the jury's not out. You have lied to the people of Ohio. And you have put an unconstitutional, indefensible ban or indefensible mandate as a burden on the people of Ohio, oppressing us under the fear of COVID-19. Let's use science and not emotional reactions. I've already sent a message to you and to Lieutenant Governor Husted. We could make Ohio a shining example if we don't bow to the fear. I mean, heck, Texas did a mandate before we do. I used to love Governor Abbott when he was Attorney General when I lived in Texas. He has lost his mind. Like, he is not the same person I remember when I used to live in Texas. Let's stop the nonsense and stand up for what is right. And to heck with the media, to heck with New York and California. Who cares what they think? Let's do what is right first. Now, let me take this discussion to another level. should we do? And I say, turn to the Bible, do what God says. I'm not so happy with the way you have treated churches through all of this. That's what seeing your guilt trips on the churches, seeing other governors trying to clamp down, close, fine churches. It's not acceptable. That's what woke me up to what was really going on. But I think God gives us a clue as to how we should deal with this. 1 Timothy chapter 1, verse 7, it says, "For God has not given us a spirit of fear and timidity, but of power, love, and self-discipline." Or other translations say self-control. He's not giving us a spirit of fear. And that's what most of this reaction is. It's fear-mongering. It's just getting caught up in fear of coronavirus. And that's not how we should react. First, we should react in love. Love in protecting those who are most vulnerable. The elderly, and those that have the pre-existing conditions that may make them more susceptible. You don't quarantine healthy people. But we want to protect those who are more vulnerable. So, quarantine those who are sick, protect the elderly, and let the individual make the choice whether they think they need to wear a mask, whether they want to be locked down at home or not. These sweeping mandates covering everybody has done more harm to our state than good. Being locked down has weakened our immune systems. Putting a mask on has driven us further apart from each other. You don't see facial expressions. People don't just stop and talk. We're all living in fear of each other. We are turning against each other. We need to act in love, not fear. Elsewhere in the Bible it says love casts out fear. We need to do what is right to help each other. If you're sick, stay home. But if you're not, you should be able to live your life and help others instead of shutting down the state and having businesses shut down, having people lose their jobs. I'm going to do another video where I look at the actual data from the Ohio State website of cases and hospitalizations and deaths, because what's being said about that data does not line up with what I'm seeing. We need to act out of love, not fear. Second is power. God has given us a spirit of power. We need to trust God. Not be stupid. Not blindly run about. But we need to trust that God is in control, because we obviously aren't. Whether from the data that we looked at, whether you wear a mask or not, it's questionable whether that even does anything. I mean, the data shows lockdowns haven't done squat. We are not in control. God is. And so we trust that. We act responsibly. We act out of love. We trust God will take care of the rest. Not living in fear, cowering in our homes, and fearing every other person we come into contact with. 3, self-discipline or self-control. Again, self is the key word there. The individual must take care of themselves, not pressure from above, fear controlling a person's actions. Is this virus as dangerous as we're being told? Let's look at the data. Again, self-control, let's look at the data and act from knowledge, not from fear. Act from love, not from fear. Act from power and trust in God, not from fear. Governor DeWine, Lieutenant Governor Husted, I'm also going to send this to my local authorities, city and county. Let's look at the data and act on the data, not the hype, not the fear, because we're creating more problems than we're fixing right now. So I beg you, slow down. Don't listen to all of the other voices. Don't give in to peer pressure. Look at the actual real science. Look at the actual real data, and let's make informed decisions. I'm not a doctor. I have a PhD in physics, not medicine. I'm a data analyst. So I know data. I know papers and conclusions and looking at all of that. And the data doesn't line up with what we are being told. Let's make wise decisions. And above everything else, I beg you, get on your knees before God. Ask Him for wisdom. And trust that He is great. He is in control. We don't have to be. We just have to be faithful and do what is right. So I beg you, for the sake of our city, county, state, nation, world, the world our children are going to inherit. I have 4 kids, and it devastates me what I'm seeing happen to our country right now. We need to turn this around. Thank you for listening. God bless. And may God bless the United States of America.